we put an implant above the muscle or below the muscle, or in some kind of a combination, is largely dependent on your desires and what you're bringing to the table in terms of your anatomy. When I started practice after my residency in about 1990, we were putting the vast majority of our implants above the muscles. These were gel implants, and by and large, they worked really well. When we were kind of stuck with the saline implants in the early 90s, we found that the techniques that we used to do a decent augmentation weren't translating into the saline implant. And that really developed a tremendous interest in submuscular placement. And in this country, we've kind of been stuck in that mindset that everything has to be under the muscle. With the introduction of a new set of implants, what are euphemistically called gummy bear implants, these are the highly cohesive gel implants, we find that we can actually go back to some of our thinking. There are times that it is appropriate to put the implant above the muscle, and there are times that it's a really bad idea. The way that I currently think of this is that if somebody is fairly thin, they don't have a whole lot of tissue, we're utilizing the muscle to help hide the surface irregularities and imperfections of the implant within its anatomical placement. So in other words, we're using it just to help cover or camouflage the implant. When I do want to go above the muscle, and those are in unique situations, people who can't afford to lose muscle strength, professional athletes, personal trainers, chiropractors, individuals who really depend on having their muscles intact, can't afford to lose the strength, and that's part of what happens when you go under the muscle. So in those situations, what I prefer to use are the highly cohesive gel implants or the gummy bears. These are tapered in such a way, they're constructed in such a way that it doesn't look like an implant. It actually looks like a breast. So I think that we have expanded that question a lot, and we have lots of different options. Clearly, this is something that depends on the individual patient. It depends on you. And if you bring the anatomy to the table that you're a decent candidate for an implant above the muscle, then I think that that's a reasonable choice.